Hello, everyone. Welcome. So glad that you could join us today. My name is Gary Parker. My pronouns are he, him, and I have the great honor of serving as the president of Influencing Social Policy. ISP is a membership organization that is dedicated to keeping policy one of the central cores of the social work profession. And we invite you to be a member of ISP. We invite you to go to our website, Influencing Social Policy, where you can learn more about what we do as an organization. A lot of what we do is produce informative webinars like you see here today. We also produced a webinar just a week ago on how to keep social works professional designation in the Department of Education, which was very well attended. We have another couple of great webinars coming up on Wednesday, April 8th. The incredible Shannon Lane will be joining us to give a talk on democracy and social work. Those of you who know Dr. Lane is the director of the Humphreys Institute for Political Social Work at the University of Connecticut. And then on Wednesday, May 6th, I'm very excited because the legendary Mimi Abramowitz is coming to give a talk on Make the Family Great Again, Trumpism, Women, and the Welfare State. That is going to be one that you don't want to miss. I'll put a link to details and where you can register for those amazing webinars in the chat so that you don't miss out on any of those. But today we have another terrific talk on a topic that I hold very dear to my research heart, which is the importance of paid parental leave. And for that, we have the associate professor at the School of Social Work at the College of Science at Michigan State University, Sacha Klein. Sasha, thank you so much for joining us today and sharing a bit of your work. And we're looking so forward to hearing about it. And I just wanted to let the folks who are joining us today know that because this is a webinar, that your cameras and your microphones are disabled, but please use the chat. Oh, I have to enable it, and I'm going to enable it so that you can put your questions in there. You can talk with each other. You can share resources, and we want to hear from you. But first, before we hear from you, we want to hear from Sasha. Welcome today.
Great. Well, thank you, Gary. I appreciate the opportunity to speak to a subject that is a real passion of mine as well. Before I start, I see that Elena has her hand raised. So I just want to make sure, Gary, you knew that because I know you're monitoring
I'm going to
the
take care of all
chat.
of it. Yeah.
So let me start by just sharing a little bit about myself and how I got into the topic of paid family and medical leave. I primarily think of myself as a child welfare and a child and family policy scholar. So I came out of the public child welfare practice field as a social worker. Like many people in that and related fields, I sort of was hitting my head against this wall of visible and invisible policies that were making it very hard for me to help families show up for their kids the way they actually wanted to. And so I went back to school and I studied the role of public policies in helping to prevent child maltreatment and ideally helping to keep families, whenever possible, out of the child welfare system. And so that's how I eventually found my way to paid family leave as a policy. I read an article that talked about how in California, when it created its paid family leave policy, the rates of hospital admissions for pediatric abusive head trauma for babies, which is indicative of a particularly severe form of physical abuse, significantly went down relative to other states that didn't have paid leave. And that got me very interested in the policy, not only in the ways it's generally talked about in terms of supporting work and in particular women's involvement in the workforce, but in terms of helping families thrive and provide safe and nurturing environments for children. So that's a little bit about me. I also like to tell people I am what I describe as an ambivalent social work academic. I was in the public policy field, not just child welfare practice, but in policy for many, many years in the federal government and in Los Angeles before becoming an academic. And so I try to always have one foot in the policy world and really think about educating future social work students and doing research that actually informs policy decisions that are being made locally and nationally. So excited to be here. Let me go ahead and share my slides with all of you, and we can follow along. So I'm going to present for 35, 40 minutes, and then Gary will then moderate a discussion. So please, if you have any clarification questions, feel free to dump them in the chat. I can answer those as we go, but we'll also have time set aside at the end to dig in more deeply to the topic as a group. So, what I'm going to cover to start are really three things. So, first, I want to talk about what I mean by paid family leave, or what I'll kind of expand and talk about as paid family and medical leave, and how it is related to older existing policies and programs, but also unique in some particularly pertinent ways. And then I will spend the bulk of my time talking about why I am so passionate about paid family leave as, in particular, as a social work issue. So what does it have to do with our profession at the end of the day? And I'll give you a hint, a whole heck of a lot. And then I will end by talking about some of the ways that you can take action in supporting paid family medical leave in this country and locally. So, what is paid family and medical leave? So, understanding the policy. In a nutshell, paid family medical leave is a policy that allows workers to take time off from work for family or medical reasons with partial wage replacement. And you'll see that that's kind of in bold on the slide because that's a key distinction between paid family medical leave and some existing family leave policies that we have in this country that do not provide financial reimbursement to workers. So, common qualifying reasons for a paid that would allow a worker to take paid family medical leave are bonding with a newborn, adopted or foster child, caring for a seriously ill family member, or recovering from their own serious health condition or injury. Paid family medical leave, there are different models for how to pay for it, but typically it's funded a lot like FICA. It's funded a lot like the way we pay for our Medicare and our payroll or our Social Security, which is through a state payroll tax that typically is a mixture of employee and employer contributions. So you may already, I hope you are, be already familiar with the Family Medical Leave Act, which was passed in this country nationally in 1993. A lot of questions I get from people around paid family leave is like, well, don't we already have paid family leave? I thought we had FMLA. Like, isn't that the same thing? So FMLA, or the Family Medical Leave Act, provides up to 12 weeks of unpaid job and health insurance protected leave for workers. And so that's one key distinction. There's no wage replacement for workers who take it. And so most Americans who qualify, which actually is a fairly small percentage of workers in this country. So you can see in the blue, only 56% of US employees are actually eligible for FMLA. And most of folks who are eligible, even though they're eligible, they can't afford to take it. They can't afford to lose a paycheck or two paychecks or three paychecks. Their families just can't function that way. And so even if they're eligible, it's often of limited benefit. The other key thing that distinguishes it from paid family leave, besides the fact that FMLA doesn't include payment, is that it only applies to certain employers and therefore to certain employees. And in particular, you have to be working for an employer that has at least 50 employees. So small businesses, which increasingly is where a lot of Americans are employed, you're not even covered under FMLA, which often comes as a real shock to people when circumstances really call for them to need it. And then they find out, oh, I work for a small business, a startup, whatever. And actually, there is no FMLA even for me. And you have to have worked there for at least a year, about 1250 hours in the sorry, that should say past year, not part year. So a lot of people who have more tangential connections to the workforce aren't going to qualify for FMLA, even if they work for a large employer, because they may be cycling in and out of different jobs and therefore they haven't been there long enough to qualify. That's why so few workers in our country qualify even for that basic protection, which essentially says if you take leave for your own health, for a child, or for to care for an older adult in your family, the guarantee that FMLA provides is you will get your job back when you come back to your worker, your employer, or an equivalent position, and we won't retaliate against you for taking leave. That's in a nutshell the kind of key protection it provides. So, in contrast, paid family medical leave offers paid leave and a broader coverage in states that have paid family leave programs. It also tends to include a more inclusive definition of family. One of the ways we fight the culture wars in this country is around policies that affect families and then deciding who qualifies as family and who doesn't. Paid family leave tends to have a broader definition of who would potentially qualify. Um, and it builds on FMLA by addressing, in particular, the financial barrier to taking leave. So another question that comes up is when we talk about paid family medical leave, how is that different from paid sick leave? So increasingly states pass not just paid family leave, but they pass paid family medical leave in almost all cases. So the medical leave, that's the part that allows you to take time off from work for your own illness or injury, or to care for, well, that's the main part. That's the medical part of medical leave. The paid family leave is the part that is sometimes referred to as bonding leave with a baby or a new child to your family, as well as to care for an adult in your life, maybe an aging parent, grandparent, etc., who needs your care. Um, but the reason that medical leave is included is because even when people have access to paid sick leave, which many people don't have guaranteed access to in their jobs, but when they do, paid sick leave is usually provided in a way that's really meant at the end of the day to cover short-term illnesses that an employee would have. So, you need to go to the doctor for something, you catch a cold, a flu, etc. So it's typically given to employees by an employer for a matter of days per year, or if you're lucky, you might even get 1 or 2 weeks of paid sick time a year. It's earned while you're on the job. But if you get cancer, if you get a serious medical condition, if you are in a horrible accident like an employee of mine just was, and your legs are shattered, like you need way more than 2 weeks in a year of recovery before you're ready to come back from work. So paid family medical leave covers those longer term healthcare needs that can last from weeks to months. And both policies are essential, but they serve different purposes in terms of worker health and financial stability. So those are the policies. So when we talk about paid leave, we're talking about paid family medical leave, things that cover those longer term needs, and providing some amount of your wage that you would normally get paid were you at work during that time, so that workers can actually afford to take leave. So this, in my mind, is a core social work issue, but at least in my education and in my professional experience, it's one that I very rarely hear social workers talk about. So that's part of why I was excited to get to talk to you about this today. So as I'm sure all of you are aware, we have a set of core professional values that guide our code of ethics. There's really six. They're on the screen in front of you, but I want to talk about the four that I mentioned here on this slide, all of which I think are centrally connected to paid family leave. So service, social justice, the importance of human relationships, and the dignity and worth of the person. So in terms of service, we know that 1 in 4 20-year-olds can expect to be out of work um, for at least a year during their career, looking into the future, just for their own healthcare needs. We know that 72% of mothers and 93% of fathers who have children at home are working, they're in the labor force. And that we have, and actually this number is a little old, it says 45 million. We now know it's actually closer to 63 million Americans are providing caregiving services to an adult or another family member for either in their home or that person may be living outside their home, but they are providing significant caregiving labor to meet the needs of a loved family member. And so this is an issue that affects a huge swath of this country. When we talk about service as a social work value, we're essentially talking about the idea that our primary goal or mission is to help people in need and address social problems. And I would argue that Americans being forced to choose between caring for their own and their loved ones' health care versus having a job and being able to pay their bills is a massive social problem in this country. So there's been quite a bit of research on paid family leave, especially since 2004 when California passed the first paid state level paid leave policy. And it's really quite compelling as a body of evidence. So without boring you too much with a bunch of research, I'll say the following. All of these outcomes that are here on this slide are things that have been linked to paid family leave. So we have evidence that paid family leave has positive health benefits both for parents, particularly the mother, as well as for children. So, for infants whose parents are able to take paid leave, it's associated with lower rates of premature and low weight birth, which is predictive of all kinds of future health risks, lower rates of infant mortality, longer duration of breastfeeding, which is also linked to positive parent-child relationships and better health outcomes, higher rates of infant immunization, increased adherence to a well baby pediatric visit schedule. In other words, babies are getting seen by doctors like they're supposed to be. It's more likely that that will happen. And then an area of research that I've been closely engaged in, which is we now have several studies that link state paid family leave to reduced rates of infant child abuse and neglect. For moms, it's associated with reduced postpartum depression and better recovery from birth. Overall, indicators of physical and emotional health and well-being is positively associated. And then it's increased access to postpartum care, especially for Black, Indigenous, and other people of color, which we know is a really critical piece of addressing racial disparities in infant mortality. So paid leave helps with that as well. And then kids whose parents take paid leave, there's indications that they have better child developmental outcomes. Pretty powerful stuff overall. So when we think if our goal is service as a profession, this is a policy that has been shown to improve the health and well-being of people quite in a wide variety of ways. In terms of workplace and societal benefits, there's also research to show that it promotes gender equity. So that often when there's paid family leave available, when fathers take that leave, that actually improves gender relations in equity within couples. It enhances, not surprisingly, employee morale and productivity. It strengthens family bonds and long-term child development. And it contributes to a more resilient and inclusive workforce. One of the more sort of controversial aspects of paid family leave is what are the economic benefits of it? So, when there's pushback on paid family leave, it's typically coming from the corporate sector, the business sector, which is concerned about what it's going to mean for business if a business has to provide this kind of leave for its employees. Well, what research shows is that paid family leave and medical leave helps families avoid income shocks during medical or caregiving crises, that it reduces reliance on public assistance programs, right? So, in other words, it's saving taxpayer dollars in those ways. That many employers actually benefit from higher retention rates of employees and less turnover amongst their staff and employees when they provide paid family and medical leave. And then it definitely supports economic participation, especially for women and especially for low-income workers. So, in terms of service, I think it's pretty clear. It's hard to argue the point that there's lots of good things that happen when paid family leave is available. And that's part of why, even though as a nation, our federal government has been disturbingly slow to act. on implementing paid family leave. So many states are actually starting to pick up the ball because the evidence is so good. So, in terms of the importance of human relationships, I think that one's pretty self-explanatory, right? Paid leave allows you to value your family and be there for them when they need you most. We are one of the only countries in the entire world that does not provide or guarantee at the national level some kind of paid family or maternity leave. So, in most countries, maternity and or family leave is a legal right guaranteed by the government. There are actually only 7 countries um, in the rest of the world besides the US that doesn't provide that. So we are in a club at this point, along with it's like Papua New Guinea and trying to think, Palau, Tonga, Suriname. Like there is no industrialized westernized democracy other than us that fails to provide this as essentially a guaranteed human right for its citizens. So I want to pause and show you a clip of a video, which I encourage you. The entire video is available. It's a documentary that won a number of awards called 0 Weeks. But I just want to show you the trailer because I think it does a nice job of highlighting sort of what this means, as this policy means for people in terms of the quality of human relationships. I'm sitting here on behalf of anyone else that's actually facing this right now today, whether or not they need to go. I'm sitting here on behalf of anyone else that's actually facing this right now today, whether or not they need to go to work or be able to sit by their husband's bedside, their child's bedside. Many folks have expectations that the government guarantees them paid time off when they have a family emergency, and that's not the case. I went to work every day and left on my lunch break and did radiation and went back to work. I ended up working 3 days after my daughter was born. There's nothing we can really do. Dad, he had leukemia. He was fired. You might not have a job to come back to. I found myself sitting in a cubicle at work while my son is in the hospital, really fighting for his life. And that's a decision no parent should have to make. Paid leave is part of the economic and social fabric of the entire industrialized world. It's Papua New Guinea and the United States in a league of their own. Every worker in this country will have a life event, an ill family member, a dying parent, or a new child. Your body went through so much, just giving birth to a whole human being. We are in the midst of an unprecedented elder boom. It's proven everyone can use paid family leave, everyone. I've been working on this for more than 3 decades. Business leaders help break the myth that this is an anti-business policy. There's cost for doing something, but there's also a cost for not doing something. We're going to see a growing movement. Paid family. So unpredictable. We don't know if we're going to have an accident. We don't know if the parent we love is going to need major heart surgery. You have a child, there's no bonding time with her whatsoever. Even though I'm the one with the cancer, this life is not about me. Imagine what happens when those things occur and you discover that you don't have the time off. We need a serious discussion of family values, real family values. Why is it that the rest of the world has figured this out and we haven't? So let me pause there for a minute. And I apologize, Gary. I didn't check to see if this was possible. I wanted to invite people who are on the call, if anybody wants to share their own experience with a time when they needed paid leave to care for themselves, a child, or another family member. If anybody wanted to share a little bit about their experience or their reaction to that video. Is it possible for people to raise their hands and be taken off of mute?
I think so. Let's see. Do we have a hand up? We do. All right, Megan, I'm going to see allow to talk. Go ahead, Megan.
Hi. So I'm from the state of Connecticut and we do have paid family leave here. 2 years ago, my mom was diagnosed with brain cancer suddenly, and I had to unexpectedly go back home to Ohio to go take care and help out my family. And I'm very grateful that I got paid leave. We paid about 80% of my salary. that I could go home, and I get about 3 months, and I was able to go home for 5 weeks with no repercussion from my job. And it really was great that I got to be there for my mom and with my mom. And paid family leave is definitely a really important thing, that really ensures protection of like not losing work and being able to focus on the needs that you have with whatever it is, whether it's for taking care of family, childbirth. So it is a really good policy here in Connecticut.
I'm so glad you had that and you're in a state that had it. That's great. Did I also see Risha?
Yeah, I was gonna share a time similar kind of. So when my son was being diagnosed with his autism and ADHD, the school did not know how to, go about that. So they called me every single day, and I was having to leave work early every day, and it became like kind of a problem. So I did request first I did FMLA, but once I ran out of my paid time off, then I did request for um paid family leave, and it actually I got, I believe, 6 weeks, but it was more than enough time for us to, finish his diagnosis, get him situated and put in a smaller class to where it made sense. But yes, it definitely came in hand.
That's great. Is anybody on the call, has anybody had an experience where they're in a state that doesn't offer paid family leave, or a time when they weren't able to get it when they needed it? I'm so glad. That's great. Um, I I'm going to share from my own experience when I had my first child. I was fortunate because I had an employer who offered 3 months of paid leave, which is like way better than, a typical American gets, although it's nothing compared to other countries. But right around the time that I needed to go back to work, I was weaning him, and when I weaned him, um, my hormones or whatever happens to your body crashed out, and I experienced sort of like a delayed postpartum depression. I started to have panic attacks constantly. I could not function. I would sit down to start to try to prep my classes and work, and I would literally have a full-fledged like panic attack and couldn't do anything. It was horrible. And I was fortunate because my boss at the time um, was just very compassionate and understanding. And so ended up giving me beyond those 3 months a couple more weeks, which is what I needed to kind of get for my body to make that adjustment and for me to be functional again. But had that not been the case, I was starting a brand new job. It was my first, I'm at Michigan State. That was right. I was pregnant when I came and started the job. So I was right at the beginning of sort of forming my academic career here. It could have been really a disastrous, awful way to start that. But fortunately, that isn't what happened. But I thought for a moment there that was what was going to happen. And it was really quite scary. And that was under a situation where I actually had paid leave, just not as much as I needed in that particular case. That time, we know as social workers, we know about attachment theory, we know about the importance of bonding and those early bonding opportunities. And when I talk to women who, and I've known many of them who within 1 to 2 weeks of having a child, like where their body is still actively just physically recovering from the experience, have to go right back to work. And they just don't have a choice. Because of policy and because of their financial situations, how disruptive that is in so many ways, including to just their ability to form a healthy attachment to their child. There's no way to, for instance, like you can't continue breastfeeding under those circumstances, which is really helpful when it's possible in terms of attachment. And different employees, or excuse me, employers offer different opportunities around pumping and things like that. It really can be disruptive to those relationships. So, because of the benefits, because of the importance of this kind of policy and the federal government's sluggishness in terms of acting on it, we have states that have started to pass these policies. So you heard mention of Connecticut. I mentioned California was the first. There's a list here on the slide of the other states. Right now, we have 13 plus the District of Columbia that have enacted mandatory paid family and medical leave programs. And there are three other states where that are likely to come online in the next year. So Virginia, possibly Maine. I'm blanking on what the other one was. Is it Massachusetts? And Massachusetts is already on that. But there are a couple more. We had a campaign here in Michigan. We even had a governor who came out in her State of the State address and talked about paid family leave, but they were not able, at least at this moment, to get it off the ground. But there is a growing movement at the state level. So another one of our core values is social justice. And I think this is where I get the most inflamed about this issue. Um, Paid family leave, in addition to being a service issue and related to our other values, is 100% a social justice issue. So social justice being about equality and or equity, and making sure that people have fair access to the things that they need in order to thrive and survive. So a couple there's been some recent data that's come out. AARP and the National Caregivers Alliance have done a survey, and they found some really interesting information about people who are functioning as caregivers for family members. So I'll start by kind of pointing out the first piece, which is that only less than a third, only 27% of civilian workers in the US have access to paid family leave through their jobs. So our current system basically says this is a benefit that employers can choose to provide or not to. And if people get it, it's going to be through their employer. That's the way it functions in Michigan. That's the way it functions in states that don't have this policy. Only 4 in 10 members of the civilian workforce in the US have access to short-term disability insurance for their own serious illness or injury. Right. So a lot of the times the pushback you'll hear from people who don't like this policy is like, well, they can just get it, they just need to work hard and get a good job and then they'll get it through employment. But the reality is that it's not available through many, many employers. We also know that low-wage workers are far less likely to have access through their employers than are higher wage workers. So there's a real economic injustice in the way this benefit is distributed in the US. And that even for privileged folks like myself, it still is not widely available. So about half of highly paid professionals have access to paid family leave through their employment. So still half of us don't even have access. And we are amongst sort of the lovely, privileged, like lucky elite, right? Nearly 1 in 4, I mentioned earlier, 60 million adults in the US are now family caregivers. And this number is rising and it is rising fast. It's up 45% since just 2015. And probably from your own anecdotal experience, like more and more of us, as people live longer, are caring for aging parents, often at the same time that we are caring for a child under the age of 18 who's still at home. So I, for instance, spent my morning today figuring out how to get an electrician into the house next door to me, which my 87-year-old mother is about to move into, and I still have a 12 and a 15-year-old at home, plus another child out of the home, right? That's a very common experience for Americans. 70% of working age caregivers are employed, right? So not only they're caring for a family member, and when I say caring for a family member, I'm not talking about lightweight babysitting. I'm talking about people who often need assistance with multiple what they call ADLs, right? Adult daily living needs, toileting, mobility, many. The number one reason besides just old age that people are caring for an adult in their life is because of dementia. People with dementia have a lot of caregiving needs, right? So this is serious, serious work. And there are ways for some people to get paid to do this work. But the vast, vast, vast majority of people doing it are doing it for free on top of a job that they need in order to pay their bills. And we know from research that caregiving takes a serious toll on caregivers' physical and emotional health, that 1 in 5 family caregivers report less than ideal physical health. It's a racial and a gender justice issue. Women account for the large majority of family caregivers, and African American or Black adults are substantially more likely to be providing what gets referred to as intensive family care. So this is the level of family care where like you're looking at multiple hours, more than 20, often 40 plus hours a week of care. Like it's another full-time job for a family member, as well as helping them with more serious disabilities and needs that often are, frankly, it's a very physical job for many people. So the distribution of this labor is racialized and it is gendered. We also know that African American, Latinx, younger and lower income caregivers are more likely to report that they're experiencing negative financial burdens as a result of family caregiving related to not being able to save money, increased debt burden, not being able to pay their bills and basic expenses. And that LGBTQ plus members, caregivers, are more often experiencing negative financial impacts related to an inability to save or afford basic expenses. So there's a real economic cost, right? And who experiences that cost, it really depends on gender and racial factors. We also know there's a disability rights issue. So here in Michigan, where I live, adults with disabilities are more likely to be caregivers themselves than adults who don't have disabilities, right? So oftentimes the person who is able to provide care is the person in a family who's earning the least amount of money. And if somebody already has a disability, that may be them, right? So a lot of people who are experiencing this burden have disabilities. And then many people maybe didn't have disabilities when they started providing care, but as I mentioned, it takes a toll on you physically, emotionally, and mentally. Workers with disabilities may be even more or less likely than other workers to have access to paid leave because they're disproportionately employed in part-time and underpaid work, where less than 10% of the workforce has access to paid leave. And then lastly, when it comes to our value around the dignity and worth of all people, I feel like no one articulates this as well as AOC. And so I'm going to show a brief video of hers, just like a 2-minute video, but her talking about this issue during a congressional hearing.
So the market has decided that women and people who give birth deserve less time with their children than a dog. Ms. Gressler, you said earlier that you don't believe in a minimum wage. Is that correct? You believe the market should decide?
I don't think that we should take a job opportunity away from somebody if they're willing to work at a particular wage that the government is not allowing.
So no, you don't believe in a minimum wage. I take it you don't believe in health care as a right either. Is that correct?
I believe that we should help provide access to health care.
Okay. Do you believe employers should offer health care to every employee that they have?
I think that as part of a benefits package, they should determine what is the best way and what do the workers want.
Okay, so no, you don't believe it should be uniformly offered.
I think it should be what workers want and what employers.
Okay, so the answer is no. So, and similarly, your view on parental leave is to let the market decide. And I think what we've seen here is that the market has decided. Ms. Szabo, 80% of families don't have access and workers don't have access to paid parental leave, correct?
Paid family leave. So care for a child or a seriously family member, about a half of moms don't have access.
So the market's decided. And what is the most common length of parental or paid family leave that you have seen?
In general, it's like 6 to 8 weeks, but it really depends. And there's not a great, there's not a great sample that tells us.
6 weeks. Do we know how long puppies are allowed to stay with their mothers after a dog has given birth?
I don't.
8 weeks.
Wow.
So the market has decided that women and people who give birth deserve less time with their children than a dog. And I think that at its core has shown that the market has failed to treat people with dignity and with basic respect. And so when that happens, I think it's our job as the public to redefine the rules of society and to treat people who give birth with the dignity that they deserve. Thank you very much.
It's a popular
So the
clip in my household because the woman she's interviewing at the end, I went to middle school with. So my kids always like to watch that clip because they know her. She's famous. Um, so clearly, I think a social work issue at many, many different levels, and one that certainly affects in social work. It disproportionately affects low-income people and other people in our society who we have marginalized in other ways, people of color, women, and under gender and sexual minorities. They're really bearing the unfair brunt of caregiving demands without support from employers or from the government. Um, so on that note, I want to talk about what then is our responsibility as social workers, as social work educators, as social work practitioners, to address the inherent injustice in the current system when it comes to paid family and medical leave. So I'll start with talking about what's happening at the national level and how people can get involved in that. And I hope as I kind of cover this last section of my slides that you'll really think as you're listening about yourself and try to meet this work and these opportunities where you're at. So think about what, if I could pick one thing that I feel like maybe it's a little uncomfortable, maybe it's a little bit of a stretch, but if there's one thing that I could do if this resonates with you, if this feels like something that you do feel passionate about, what might it be? So I mentioned before, we don't have a national paid family leave policy. We came close under the Biden administration, and then that failed at the 11th hour to pass nationally. But there is currently legislation at the federal level, the Family Act, which stands for Family and Medical Insurance Leave Act, that has been introduced. It was introduced the last legislative session. It's been reintroduced this session in the Senate. That's Senate Bill 2823, sponsored by Senator Kirsten Gillibrand. And in the House, that's HR 5390, sponsored by Representative DeLauro in Connecticut. And both of those bills currently are sort of sitting in committee. So they were introduced. And the way our legislative system works is when a bill is introduced, it's immediately assigned then to a committee that has some sort of jurisdictional expertise and authority around that. So that's a smaller group of legislators who specialize in a particular topic area or subject area and review bills there. The way our partisan political system works in the US is that whichever political party holds the majority in that house, basically, they decide who chairs each of those committees. And the committee chairs decide which bills ever see the light of day and which ones simply die in committee. So, what's currently happened with these bills, since both of their sponsors are Democrats, and there tends to be some fairly decent support, not as strong as I'd like it to be, but there is some support for them in the Democratic Party that's not shared by the Republican Party. Because the Republicans hold the majority in both those houses, those bills were assigned to those committees, and currently nothing is being done to advance them. They're not even being discussed, voted on. There's no public hearings on them, etc. So that's the current situation. So let me tell you a little bit about what that bill would do. It would provide coverage, paid coverage, for up to 3 months or 12 weeks for family medical leave. It would use a sliding scale to decide how much, what percentage of someone's wage they would get. So on average, it's about 66% of your wage. It maxes out at $4,000 a month. But the poorer an employee is, the percentage is higher. So for a very low income employee, they would get 85% of their wages replaced, which makes sense, right? Because when you're making minimum wage, losing let's have to do the quick math, 34%, is that right? Of your salary is not sustained. I mean, you can't afford to do that. You can't afford to lose a third of your salary, right? So it makes sense that for very low income employees, you would want to have a higher wage replacement rate. And that's the way it's structured. That's a lesson that was learned by the states, looking at kind of what worked and what didn't work in states that had these policies. It would cover the following reasons. for leave. So a serious personal health issue, pregnancy or childbirth, bonding with a new child. So that includes not only a newborn, but also a foster child or an adopted child. Caring for a seriously ill family member. And then it also includes needs related to military deployment and safety leaves, which has to do, and this is a newer addition that research has really highlighted. So that's services for survivors of intimate partner violence and sexual assault and stalking, who really need that time off from work in order to take the actions they need to do to stay safe from their abusers. And so that's part of that leave. That would be part of that bill if it became law as well. Eligibility is broadened, like I mentioned, so it includes part-time workers, not just full-time workers. It covers more younger workers, low-wage workers. It covers blood family. So if you need to care for a seriously ill family member, that's not just a member of your nuclear family, that includes extended family members. And this is really important to me. I have a daughter who grew up in the foster care system and who is not related to me by blood, but is absolutely my family. And this bill includes chosen family as well, like that. Um, and it is regardless. So unlike FMLA, it is regardless of the size of the employer, the hours you've worked, or how long you've worked there. It ensures you can return to your job, that you get to keep your health insurance while you're gone, which makes a lot of sense, right? And that you don't face retaliation for taking leave. And it's funded through that mechanism I mentioned earlier, sort of a shared payroll contribution. It's a very low, low tax, and half of it's paid by employers, half by employees. So, like I mentioned, that is currently sitting in committee untouched. And probably the most reliable way to make that change is to change who is chairing those committees, right? And getting somebody in place in those committees who's going to be more favorable and more open to considering these bills, right? So at the moment, that is the Democratic Party, but that could, if things changed fairly dramatically, that could include Republicans that were persuaded to do so. So advocacy around getting those bills discussed and put on the agenda in those committees is really, really critical. National organizations that are working on that and related things on paid family medical leave are the National Partnership for Women and Families, Paid Leave for All, and Moms Rising. Um, and things that you can do around national advocacy right now, ways you can help are the following. So, sharing stories and helping your clients and your students share theirs. Stories are powerful. You can't argue with people's stories, right? Like it's different than data and research and all that kind of stuff. And personal stories are much more likely to influence policy. You know, people who go and they talk to their socially conservative legislators about the fact that they were thinking of having an abortion because they didn't have a way to take time, have a baby and take time off from work and have that child and care for that child. Like that is a story that may be influential, even with some more conservative legislators, right? This resonates for people in lots of different ways. And the best way to tap into that is talking about your personal experience. One of the reasons that in Michigan, the bill that is still, I guess, under consideration for paid family leave, it includes a piece around bereavement leave, which I don't believe is in the national bill. But part of what led to that being included was hearing the stories of people who had stillborn children and had to get up the next day and go to work because they didn't qualify for any kind of paid leave. I heard the story, it was horrifying to me, of from a grandmother whose daughter-in-law uh, baby was born dead. And it was horrifying. You know, the hormone crash, just the grief and the loss were tremendous. And the mom was suicidal after it happened. And this woman's son, the father, got 24 hours off from work and had to leave his suicidal wife while he was still grieving the loss of this child that they were expecting to have. And he had to leave his suicidal wife alone and go back to work, right? So those kinds of stories that people share can be really powerful in terms of breaking down barriers. Encourage you to join social action campaigns that are working on paid family leave issues. Those vary state to state, but volunteering, donating, attending events, using your expertise as social workers, many of whom you guys have training and experience in advocacy and social action on how to advance these issues in ways that are creative and effective, is very powerful. Educating others, hosting workshops, writing op-eds, speaking at community forums, and talking, especially those of you in education, talking to your students and those of you who are in practice, talking to your clients about this issue, um, which we're mostly just so silent on. Certainly contacting your representative, and that can be through scheduling a meeting with them, going to their town halls, phone calls, emails, etc. And then voting to support candidates who prioritize paid leave. I think one of the most critical things that needs to happen for this to advance, especially at the national level, is we need to get more candidates who run on this issue. It's a very popular issue with voters. Everybody experiences the need to care for people in their lives. It resonates across the political sort of the partisan divide. And so, really working to convince people who are running for office that they should run on this issue and support them in doing that. And if you can't find somebody like that, please consider running yourself. Um, I think would really be a powerful way to engage in advocacy. Do folks on the call have other ideas about how we might advance paid family leave at the national level?
Yeah, we have about 8 minutes left. Do we want
Oh,
to
my
open
goodness,
up
Gary.
to, yeah, the
Yeah,
time
let's just
flies
open it
so
up.
quickly. Do we want to
Yeah,
open it up? Are
please
there
do.
folks that want to ask questions on this or any of the amazing uh things that Sasha discussed today? And while you're hankering over which questions you want to ask, I'm just going to put a link to a report that I did on this very topic that I think you might find interesting
Mhm.
on paid medical leave while I was the director of the Clark Fox Policy Institute. All right, go ahead, Risha. Feel free. What's your question?
I was gonna ask, are there any local um I want to say like I guess campaigns or any nonprofits that are already going kind of hard for these issues that we can kind of like just join into that y'all are familiar with? Or maybe like if they're virtual, anything like that?
Risha, what state are you in?
Oh, sorry, I thought this was for this school specifically. I am in California.
So California is a pioneer in paid leave, but that doesn't mean that the policy can't be improved. So they've had a version of it since 2004, and then they actually made it a little bit more generous a number of years later. But there are pieces like I don't know that California does bereavement, things like that.
Yeah, they
So
do.
if you would drop your email in the chat, let me find out who's leading the advocacy work in California around this, and I can email you and get you that information.
And I can tell for those of you that are in Missouri on the call that you can reach out to Jobs with Justice, who are doing some incredible work on this and actually led the ballot initiative that advanced paid leave in Missouri until the legislators turned against it and undid the work of the voters, which happens a lot here in this state. Any other questions out there? I do want to give a little shout out to Shannon Lane, who is out there in the audience with us and along with her class. And because you mentioned, Sasha, that if you don't like what your legislators are doing, that you should consider running for office. And if there are folks who are interested in running for office or interested in supporting someone who may be interested in running for office, the Humphreys Institute does an incredible program called the Campaign School once a year. They just did it, but they will be doing it again, and it is something that you should put on your radar. I've gone through the program. I have spoken at the program, and Shannon does an incredible job there at the Humphreys Institute. So a big shout out to Shannon Lane.
I could not agree more. Even if you can't picture yourself now running for office, don't let it stop you. I would encourage every social worker to go to campaign school. It's really powerful. And I've had students who've gone. We just had one who was elected to the Lansing City Council afterwards and who have run successfully. It's amazing.
That looks like Shannon put a link in there for 2027.
Um,
All right. Any final words, Sasha? Parting words you'd like to share with us before we say farewell?
Yeah, I would just say the following. I think, this is an overwhelming time in our country and in the world. It's hard to know where to focus your attention. Um, and um, And so I really think it's important for people to pick a couple issues that resonate with them and focus there. So if you're on this call because this is one of those issues, then please don't hesitate to reach out to me. My contact information is at the end of the slides. Like I will circle back to those of you who wanted to know more about what's happening locally for you. A lot, like states have been successful at winning these fights. So when things happening nationally are discouraging, I always say go local, go state. And even if the state is not a place where you feel like you can make progress on this issue, then I always tell people look in your own backyard. So start with your own employers. I was the policy director for the Early Childhood Investment Corporation in Michigan and found out that we did not have paid family leave, right? Just at like my employer, right? So you can start right where you are. Find out what your university does if you're in the university system, and think about not only does it offer it, but does it offer it to everyone? Really think about those equity issues. So, for instance, we had paid leave for faculty, but we didn't have the same level of leave for staff or student employees at MSU. So there's just lots of opportunity to work on this issue at multiple levels and from multiple angles. And thank you for caring enough to be here today and to listen and to be an inspiration and to support the families around you. People need it now. They need that help more than ever. So thanks so much. And thank you, Gary, for giving me this opportunity. I really
Of
appreciate it.
course. Please, everyone, join me in giving me a big round of virtual applause to the incredible Professor Klein for all that she has shared with us today. Thank you so much for your time, for your expertise, for your insight, and we will be sharing a recording that will include a link to your slides very shortly as soon as I can get that up on our YouTube page. So thank you again, everyone, for joining us, and we will see you at the next ISP webinar. All right, everyone, enjoy the rest of your day. Thank you again.
Thanks so
Goodbye,
much.
everyone.